I know the surgery's gonna be fine. I learned what I needed to learn. And all of this is just what needs to get me there. And after the surgery, I'm going to do everything the doctor tells me. I'm gonna take my medications. This new kidney and I will be around and love on all of y'all for a long, long, long lifetime. That transition from the not feeling well and the unknown to the discovery of all of it through the episodes, to the final episode where we've gone on this journey. She's made a lot of discoveries about herself. She's made a lot of discoveries about her family. She's come out on the other side with a new kidney. She's feeling hopeful. Felt like anything was possible.
The recovery time for a transplant recipient is about 3 months. And so we ask during that time that they take time off from work, that they avoid like heavy lifting, twisting, turning, avoid large crowds or unknown social contacts, and just talking about, especially our patients that have smaller kids or that are around smaller kids, teaching about hand hygiene, staying away from sick contacts, of course. Yeah, so it's about 3 months recovery. And then our patients are typically cleared to drive at about 3 to 4 weeks, as long as they are off all of the narcotics. Then usually at that time, they're able to drive themselves to their follow-up appointments and kind of take over their care. So we like for them to have a caregiver about 4 weeks after transplant, and then the patients are typically independent at that time.
My recovery was great. I didn't require a lot of help with it. So basically, it was just making sure I had something to eat at the house every day, made sure that, I had someone to bring me to the doctor, but I didn't have to have someone, help me get out of bed, to get a shower, or any of those things. I was able to do all those things on my own.
The most important thing that I tell patients is so important to be in control of your health, being compliant with your treatment and your medications. Your medications are so important. A lot of my younger patients, they'll say, oh, I feel so good. I don't need the meds anymore. Right? And you think about it, they've been maybe chronically ill throughout their whole young adult life or pediatric, time period, whatever, and then they get this transplant, they're feeling good, they're not on dialysis, they have this new lease on life, and now, they've got all these medications. Some patients think, oh, I feel great, I don't need them anymore, and then we see them come back with rejection, and that's a whole nother thing. So we really try to educate as much as we can before of the importance of being compliant. Even missing doses here and there, and not taking them as prescribed can overall do like long-term damage to a kidney transplant that they will be able to see. And the doctors at any time can request labs and see your medication levels, and they can tell if you've been taking your medications or not. So that's, I think, is the biggest adjustment. It's adjusting to taking so many medications for the rest of your life. We hope that this is a normal life. It's a new normal, and it's an adjustment period and process like anything that's a big change.
Otherwise, I think it's standard medical checkups, having a very good nephrologist. Having a nephrologist that cares is important, makes you have very good care. Try to get as good of insurance and as good of a medical professional as you can.
There are some financial implications as well with transplant. Of course, you need to maintain lifelong medical insurance. You need to have transportation to and from your doctor's appointments. In the beginning, you do have frequent medical appointments, usually 2 to 3 times a week for the first 90 days after a transplant. And just, with the price of gas and commuting back and forth to whatever your transplant center is, cost of parking wherever you are. If you live far away from the transplant center, you might have to take into consideration lodging close to the transplant center. And of course, time off from work, because a lot of patients are high functioning on dialysis and are working, but they do need to take off typically about 3 months during the transplant recovery period. So looking at what that looks like for some patients in regards to not being able to work and being on disability for a short period of time can be a disadvantage, but a temporary one.
I make sure I keep my doctor's appointments. I make sure I maintain my weight, and I make sure that I take my medicines. And beside that, I was just able to go back to being normal. So I'm normal. I travel a lot now. I'm making up for the time when I couldn't travel. and just enjoying life.
When you get the donor kidney, a new kidney, you definitely want to take good care of it. Because if you take care of it, the kidney will take care of you.
You have to take care of the caregiver. We tell the caregivers during, in the post-transplant education, take time for yourself. We always want a primary and a backup person for that reason. If your primary is sick or burned out or overwhelmed, we want somebody to be able to be tagged in so that they can support and give that person respite. The medications that patients are prescribed after transplant, like the steroid medications, can make them sometimes irritable or just cranky or fuzzy, and they're not themselves, and the caregiver often is the one that has to deal with the personality changes and the irritability and the I'm not taking my medication today, and it's a tough job. So we tell caregivers, make sure that you have an outlet to take care of yourself and get help and support from outside sources before it gets too bad, and of course to reach out to the transplant team if it's difficult while you're currently managing a patient after a transplant. I get to be with patients on their most exciting day of their lives, and not everyone gets to do that in their job. My job really entails providing emotional support to the patient and families after transplant, helping them understand, some of what to expect, adjusting to life after transplant, preparing them for just the realness of being immunocompromised in the world of, COVID and other things that, put them at risk, but also helping them understand that we don't want them to live in a bubble and that they've had this, life-changing surgery to have a wonderful quality of life, and that our team is there to support you.
Life after transplant, it's really important you enjoy life and kind of do your bucket list, because as we talked about, a kidney transplant typically only functions for a finite amount of time, whether it's 10, 15, 20 years. So really do what you want to do. But also realize that getting a kidney transplant is not like being completely normal, because you do have to take medications in order so you don't reject that kidney transplant. But I think you also just enjoy your kidney transplant. Go have fun with it.
This is an exciting question, thinking about what I look forward to after my transplant. I'd like to continue my education. I do have a master's in social work, but I want to pursue license. This will enable me to become a licensed social worker in the renal field, educating patients. And I am a foster mom. We foster parent children that are teens because of the energy. They're very independent, so I'd like to consider taking a younger child.
Some patients get to re-enter the workforce and get jobs or go back to school, and all the things that may have been difficult to do while on dialysis or while, battling kidney failure. Some people have the discussion with their doctors about starting a family. All these things are possible post-transplant. So there's so many things. We hope that this is a normal life. It's a new normal, and it's an adjustment period and process like anything that's a big change. But our patients typically do well and have, excellent outcomes. And some of our patients are so excited to just travel back home to their home countries that they may not have been able to do because of the dialysis issue and not being able to arrange dialysis where they are. And so they're so excited to travel, which a lot of our patients can do after about 3 months.
My cousin was not well before he had these kidneys. He was not well at all, and to see their pink color come back into his skin, to see him, he thought he was gonna die, to see him know that he could live and live a really long life, that's something special. Something special.
What made me think of the saying, all kidneys are pink? I just wanted basically people to see kidney transplantation through the lenses of a surgeon, because I can't tell what the skin color is or what the gender is or sexuality is or religion is or political party is or favorite basketball team or NFL team are. I just see a kidney as pink. I couldn't tell often if it's even from a female or a male. Sometimes there's a little bit of size discrepancy, but You know, it's just a beautiful kidney that's pink, and you just, all that other stuff goes away.
When you donate a kidney, both of you are on this journey together, right? So he's here, I'm here, we're going through all the tests together. I finally got ruled to be able to do it. I was a perfect match, couldn't be better. We get to the hospital and my doctor's super cool. Like one of the coolest dudes. I have a picture of him and he took a picture of my kidney because I wanted to have a remembrance of this kidney that went away. So I still have that picture. I should have brought it today. But I have this picture and we went through this journey and I remember afterwards, I'm not really a drug person, never did drugs, not my thing. But I remember being in the room post-transplantation, post my donation, and I am just talking nonstop. Doctors, nurses, everybody's round up around me trying to hear this story. And my mom's like, give her more morphine, give her more morphine. She is gonna rip a stitch. And I didn't, but I remember in that moment, I realized that this was a story that was gonna be with me for life. You know, somebody created this for a reason so that you could live a life that's healthy and healed and happy. And there are people like me that got to give.